So you have chest pain. Okay, describe it to me. Where is it located? What kind of pain is it? Is it sharp or is it dull? How long does it last for? What makes it better and what makes it worse? AI can certainly ask patients these series of questions about their chest pain, but chest pain assessment does not stop there. AI will have to discern where the pain is coming from. Is it the heart? Maybe it's the muscles and the bones in the area. Or is it your esophagus and stomach? Or something more dramatic like a mass. You may be able to get to the answer through a series of questions and questioning, and even trivial ones, right? Such as if you have heart disease that runs in your family. That is correct. Knowing whether your father or mother, or anyone like your grandparents, ever had heart disease is crucial to knowing your risk of having a heart attack. That's right. But wait, it gets more complicated for AI. It needs to be able to ask follow-up questions like if the pain is associated with any other symptoms, like for instance, nausea and vomiting, or even shortness of breath. Moreover, if you are a woman or if you have diabetes, you are considered a special population. So women and diabetic patients may not even have chest pains, right? And could still be having a heart attack. Man, look, that one will certainly throw off the algorithm for AI. Or AI will need to figure out a different algorithm just for women and those with diabetes. This is one of the reasons why, depending on your physician, so he or she can discern this for you. Or do you still think AI is enough to handle all this? Look, whatever your thoughts are on this, I would at least think that you would at least want to feel confident that all of these questions, right, are being answered correctly. Or at least be reassured that you are entering all the information necessary into the system for AI so they can then capture all of those things and analyze it, right? But wait, will you even remember to provide and mention all of them to AI? Will your memory serve you well? Can you trust yourself to know all of there is to know about chest pain? I mean, you would have to know what to say precisely, because I am not sure if AI would be able to capture your own, let's say, nuances around the way you say things, or even the way you decide to express yourself for that day. Can it potentially probe you like your physician do when they have to extract information that may have been in your blind spot and is helpful for diagnosing? Can you share the information in a particular order so that it creates the right narrative for your potential diagnoses? I hope you're following me already. These burdens typically falls on your physician, who is particularly trained to do so. This is their job. Otherwise, Google would have replaced physicians a long time ago. Gathering a history from a patient to make a potential diagnosis is certainly not just inputting random data into a system, which I'm sure AI is good at. It is clearly more than that. Remember, in any artificial intelligence system, you are responsible to input all this information yourself in order for it to be sorted in an analytical fashion, and the system is supposed to spit out a potential diagnosis. Good luck. I know you heard this before. Computer systems are as good as what goes in them. In other words, garbage in and garbage out. Look, another important aspect of what your physician does is to help you sort through these random facts, these random information that you tell them. So that they could know to see which one is relevant and which one is not, especially when describing chest pain. For instance, why the heart attack your grandfather had at the age of 55 is more important than the one that your mother had at the age of 85. You see, AI have a lot more catching up to do. If that does not convince you, then how about we talk about the complexity of conversations? That's right. For instance, some people are not forthcoming with the symptoms they are having, or the words used to describe what they're feeling is different, right? This is right. People actually describe symptoms differently. I don't know if you know that, but they do. This is because their culture, for instance, or their language, or even their educational level can contribute to that. All of this would make how they are describing their symptoms very unique to them. How about body language, eye contact, or just simply the physical appearance of a person which all lends to making a diagnosis. All this AI has to cover? And how about compassion? Does AI have to figure this out too? Yeah, okay. Last I remembered, compassionate physicians and good bedside manners goes a long way. So I wonder how AI plans to capture that. Just in case AI was thinking about creating a physician replacement robot, I would say, look, please consider to add a software to address the different ways that people from different cultures express themselves. See, this reminds me of a personal experience I had with one of my patients where it stressed that important point. One of my patients came to see me, and while speaking in their native tongue, Haitian Creole, mind you, he said to me that he was having pain in, quote, the sun. At first, I thought it must be his accent. But quickly I realized he absolutely cannot have an accent. The man is Haitian, and he's speaking in his native tongue. Duh, right? So after convincing myself that the patient does not have a grammar issue, I asked the question again, and he said exactly the same way. I am having pain in my sun. It was not until he pointed at the location that I suspected that he meant his chest. So I then asked, so you're having pain in your chest? He quickly responded and said, no. He took my hand and touched the center of his chest and said, my son. And this is when it hit me. My patient is a devoted Roman Catholic, and that area of the chest is referred to the sun during prayers. I was like, of course. See, whenever a Roman Catholic is making the sign of the cross, right, by using their right hand, they touch their forehead at the mention of the Father. Then they touch the lower middle part of their chest at the mention of the Son. And then the left shoulder, right, on the word holy, and finally the right shoulder on the word of spirit. There you go. My patient is having pain in the sun, and there is nothing you or I can say to change that. Certainly nothing AI can say to change that. You see, if my patient relied on AI to diagnose his chest pain, well, at least at this point in time, it would be a non-starter. See, always remember, I support the responsible use of technology and artificial intelligence. The AI that supports physicians in their daily tasks and administrative duties will always get my support. This can potentially alleviate unnecessary burden on your physician, where he or she can actually spend more time where it matters, with you. Anyway, my name is Dr. Sidney Coupe, and I am the People's Doctor. Thanks for listening.